I'm very quickly going to talk about occupational health, basically. And I know that the topic I was given was about workers' experiences in protecting health, but the phrase I really like is statistics are people with the tears wiped away. And that's a phrase that came from Irving Selikoff, a public health advocate and occupational pioneer who is very instrumental in dealing in making links between asbestos and what was happening with workers. And the other question I will often ask is, what about the workers? So the goals of occupational health were set way back in 1950 by a joint ILO and WHO committee. And actually, they are embedded in the Manitoba Workplace Safety and Health Act, very clearly about things to do with promoting and maintaining people's well-being, prevention, protection, and these days they've added the promotion of workers' rights. And in fact, in 2022, the ILO recognized that health and safety is a fundamental right and declared that all members, even if they haven't ratified conventions, had to respect, promote, and otherwise deal with the fact that these fundamental rights now include a safe and healthy working environment. So workers are involved at or affected by every stage of the life cycle, whether we're talking production or other work. This is a very simple example, and you find workers at every step along the way. But there's also sort of a social aspect to this, the social life cycle analysis. This is from a Canadian document that includes health and safety, but there are lots of things here that also get tied in with health and safety and or affect people's health because they're workers. Workers also are the canaries or sentinels of public and environmental health hazards. This is a picture from the 1928, where a canary was used to test carbon monoxide in mining. It's become the symbol for what we call in Canada the Day of Mourning. It is now known as International Workers' Memorial Day. And just as examples, I mentioned asbestos earlier. In 1917, Canadian insurance companies said, tough luck to workers. We won't insure you anymore if you work with asbestos. There are things like cleaning and disinfecting products, climate breakdown, where, for example, heat leads to kidney disease and deaths. Indoor air quality, we're going to be talking about later. I have far too much stuff about sick buildings going back to the 1980s. We can also talk about lead, pesticides, plastics, and radon in mining that is associated with nuclear power and nuclear weapons. And so this pandemic is no exception. And I just want to name some of the workers that I know of that have been died as a result of working in COVID-19. Gabriel Ding was at a poultry plant. Hiep Bui worked at a meat processing plant that had the highest number of reported infections in North American meatpacking plants. Gary Darwin Ross was a school teacher in a Pasquayac Cree Nation. Kim Cotello was a healthcare worker, and in terms of counting, was likely the 53rd healthcare worker known to have died of COVID in Canada. And last but not least, from the very early days, Karam Singh Punian was one of at least 10 limo drivers at Toronto's Pearson Airport who died by May of 2020. And there's just a lot of data around COVID these days. This is some UK data that basically shows that it's affecting people in their prime working age. And when we're talking about 4 and 5%, we're really talking a fair number of people, 1 in 25 for 4 and 5% is 1 in 20. And in Canada, the most affected sectors are healthcare and social assistance, science and teaching services, and education.
30 seconds.
And so there's a whole lot of reasons why the harm is the result of various longstanding inequities. I will leave those to the PDF I can send around. And just some data about work taking its toll around the world. I point out that occupational diseases are a fair chunk of this. And it's also about lives that are made miserable and shortened, and with the economic cost that adds up globally to something like the contribution of Germany and Canada to global GDP. And that's probably underestimating. And sorry, So protecting workers protect us all is my message, that it's part of public health. We need a precautionary prevention focus, whatever the hazards, and the use of regulations and laws. Workers' experiences and knowledge have been ignored or downplayed. They really are essential for a healthy economy and environment. And as well, the time-tested, evidence-based, multi-layered occupational health knowledge and skills, and those from other disciplines, really are essential to prevent and reduce harm from any hazard for everyone.